Third year is supposed to be a magical year where we leave the classroom, get into the hospital, and learn to become wonderful doctors while seeing real patients. In reality, a lot of it is waiting around, hoping that someone writes nice things about you and trying to sneak away to get just enough time to study for your shelf exam. In that spirit, we've recorded our classmates reading real evaluations that they've had written about themselves this year. We're showcasing the funny, the mean, the confusing, and the downright untrue words that have been written about each other, so we can all revel in the joy that we're all just part of one silly game. This is Med Students Read Real Evals about themselves. At Peds Resident. Your excitement about pediatrics is appreciated. Be careful that your enthusiasm doesn't interfere with the residents' ability to get their work done. I probably should have seen that coming after she got mad at me for following her around while we were rounding together.
At Psych Attending. Angelique was a great addition to the PSM team. She is always on time, eager to work and learn, reliable, trustworthy, detail-oriented, bright, and thoughtful. She cares about her patients, empathizes naturally, and thinks outside of the box when considering their treatment options. She takes initiative to gather information that assists in her developing a differential diagnosis. She is also quite self-reflective, which is an important asset in psychiatry. And she thinks well on her feet, even in front of the rest of the team. Angelique will succeed in whichever field she chooses. That's you, Trey.
At Family Medicine Attending. I think he was surprised by the breadth of family medicine, gained an appreciation for it, and enjoyed some gynecological procedures.
At Peds Attending. Molly's excitement and enthusiasm for pediatrics is very clear. At times, though, it seemed almost as though she was trying to prove how hard she was working rather than being 100% focused on the patient. How did she know?
At Internal Medicine Attending. This was early in the year, and internal medicine can be an overwhelming and demanding rotation. I would encourage you, as we discussed, to make sure you are getting enough rest, so you can actively participate during rounds and help the team.
After several hours in the OR side by side and several heart-to-hearts, at Surgery Attending, Vista rotated on surgical oncology as part of her third-year rotation. She attended clinic and went to the OR according to her schedule. She wrote notes and learned about surgical pathophysiology. Thanks, real personal.
Two.
At Peds Attending. Although Aaron was with the team for greater than 8 days, there were days where he did not have a patient to present. I advised him to be more proactive in picking up patients and taking ownership of his patients. Jazzy, there were 2 patients on the rotation the entire time.
We worked together for a month. I was in all of her didactics. We took care of patients together for a week. At Peds Attending. Not enough information to evaluate.
At Peds Attending. Simon's presentations on rounds were at the level of a reporter. She often read from her notes as opposed to present the information. I suggest Simon try to present with only notes as a reference, bullet points perhaps to discourage reading the notes on rounds. I wonder if this will help the material stick for her. I wonder what specialty I'm not going into.
Holy shit, thank God she forgot about me.
At Surgery Resident, Michael frequently disappeared. He seemed to have doctoring a lot.
Where did he go? Does he have doctoring?
At Peds Resident. While I encourage students to ask questions,
Soni's questions demonstrated that her knowledge of pediatrics was far below her peers. Who knew you can't give a baby any water?
At I Am Resident, Karen A is clearly intelligent and hardworking. However, she was very quiet. I could not tell if she was too shy or just didn't care to be here. I would encourage her to work on her social skills. No, bro, I just didn't like you.
Yes. At Peds Attending, encourage her to present with more confidence and decrease the use of phrases like kind of, because she knows her stuff. Kind of hate you, Peds Attending. Kind of hate you.
2 2 2 2 2 2
At OB-GYN resident, Ubby showed great enthusiasm during deliveries and during C-sections. I never saw a C-section. Don't tell Dr. Howell.
Bad evals. I don't think I have any. I guess everybody just loves me. At Peds Attending, hard worker, presentations appropriately precise, dedicated to her patients. At times, condescending even to upper level staff. Guess I gotta relearn how I ask questions.
At surgery attending, make sure you include social history in your H&Ps. This patient had a significant alcohol history, so make sure you comment on that.
At OB-GYN attending, interpersonal skills are somewhat awkward, unclear if this is culture/language differences or something more. Really?
At Peds Attending says, I appreciate your efforts to participate in the group discussion. I know that your introverted nature makes that challenging. Honestly, I had no idea we were even being graded on participation.
At I Am Attending, I encouraged Mario to work on his premature closure. That's what she said.
2 2 2 2
At Peds Attending, it was a pleasure to work with Michelle in the newborn nursery. Michelle was actively engaged and gave complete presentations. Michelle showed a genuine interest in learning newborn medicine. My name is Lauren.
Two, 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 two.